I'm Dr. Jack Fletcher and I'm the chair of the BMA's Resident Doctors Committee.
What is your response to the Prime Minister's letter in the Times?
So like I've said consistently in October, November, now March, into April, the way that we end these disputes is through constructive discussions in the negotiation room, talking about how we can fix this absurd jobs crisis and how we can also value resident doctors for the work that they do in the NHS against more than a decade's worth of pay erosion. I don't think that issuing threats via the media, I don't think that threatening to take things off the table is a constructive way to come to a resolution of both of these disputes. And I would encourage any constructive dialogue with the government today or tomorrow or Thursday to bring this dispute to an end and to potentially avoid industrial action next week, which I think we all think and we maintain is wholly avoidable even at this late stage.
You have previously mentioned that wider political issues as a reason for pursuing a better deal. The government has suggested this is likely to make future offers worse. What is your response to that?
So I think when we look at the wider economic situation versus the deal that's currently on the table, the deal that was on the table on pay was changed and the goalposts were moved right at the last minute by the government. That was an intervention that they chose to make. Now when we're looking at wider economic conditions and the deal that's currently on the table, which is the government's essentially revised deal and revised offer, what we think is that deal risks real terms pay cuts for resident doctors baked in over not just this year but potentially a number of years against more than a decade's worth of pay erosion. I think that is not reasonable, nor is it a credible offer, which is why we've had no choice but to reject it and return to the picket lines. But, as I've said before, industrial action is wholly avoidable if the government comes back to the table and makes us a credible offer to resolve the jobs crisis, as well as values the work that resident doctors do in the NHS, given that value has been eroded and degraded over the best part of a decade.
And why didn't you put the offer to members?
It's a common question that we get. Why don't we put everything to our members? Our members directly elect their representatives from across the country, across England, across the UK. Those representatives have rejected this offer. Those are directly elected by our members. We heard from the government that they wanted to put their offer to members in December. They were absolutely convinced, along with a number of colleagues in the media, that our members were not represented effectively by the Resident Doctors Committee, and that was proven to be completely incorrect. We returned an 83% reject of the government's offer then on a 65% turnout. We are confident that our members would reject this deal, and therefore we don't see a reason to burn down our industrial action mandate, which only lasts 6 months, by taking weeks and weeks to put an offer that frankly isn't good enough to our members.
And finally, what is your response to a YouGov poll showing that 53% of the public oppose strike action?
So I think it's really regrettable that we're in this position where we are returning to the picket lines once again, despite the fact that we've had pretty constructive talks over the last couple of months to try and resolve both the jobs dispute as well as the pay dispute. It's really regrettable that the government chose to move the goalposts right at the last minute and is now making threats in the media to cut doctors' jobs at a time when corridor care is the standard of care that we are providing in hospitals across this country. Last year we turned away 13 fully qualified resident doctors from every A&E job, and yet we're providing corridor care. We've got tens of thousands of patients waiting in corridors, and the government is threatening to cut yet more jobs for resident doctors. We want to get on, we want to treat patients, we want to stop the record levels of doctors who are leaving our NHS. We want to see doctors progress through their careers, we want to see them become the consultants, the GPs, the specialists of the future. But sadly, when we're facing threats of job cuts and real terms pay erosion, we don't think that that's a good deal for doctors, and crucially we don't think it's a good deal for patients either.
Well, at one level I'm more convinced we can, because I've seen so many areas where I know we can improve, and I do believe that this reset plan is the right plan, and if we can find that support that we need with that funding strategy over that 3 years to deliver it, I'm convinced that we can be one of the most fastest improving systems in the world and have some of those standards where we are absolutely gold standard by any comparison.
Okay, that's
Well, really it's vital because from the health service point of view, we need to implement this reset plan and it will take 2 or 3 years to really kick into full effect. And so we know, because we don't have a balanced position now and we've been dependent on the executive supporting us, that if we can get the reset plan in, we can reduce the reliance on that extra money. But it does take 2 to 3 years to change the service model and to get the public and the clinicians to really begin to work in that kind of way.
Is it realistic to say that it can be delivered with more single-year budgets?
Well, if we keep on having single-year budget, it just makes it so much harder to plan. And I think that delays our ability to reset the system and really to get that value for money that the taxpayer wants and get those outcomes that the public want when they use our services.
And so you're going to be talking to the public this week about some very ambitious plans for the reset of the health service. Can you tell us a bit more about the aim behind them?
Yeah, one of the big areas that we're looking to do is to get care closer to people's homes, so they don't have to go to hospital for care, and we can get people back out from hospitals who could be treated in their own homes. So that's a big project that we're working on. And what we're looking to do there is to shift not just the work, but also to bring resources from the health system into those community settings to support them at home, their general practitioners, their community pharmacists, the voluntary sector, so that we start to get that sense that the service can be brought to you and we can avoid hospitals if we can.
And we know already that the health service takes over 50% of the Storm budget each year. You officially took over in the department, and you were talking then about, really sort of pushing for some results and some actions. Has there been much progress over the year?
I think you can see, particularly in terms of programme for government, commitment to reduce waiting lists, that we've had 2 quarters now consecutively of reducing the waiting times for care. And in some specialties, that's really got them down to a much more acceptable position than they were. So in terms of elective care, I think we've made some progress there. A lot of the time this year we've been looking to get our budgetary position into a better position so that we're living within our means, make sure we can pay staff properly. And at the end of last year we were able to make the pay award, but going forward we want to be in a situation where pay, real living wage is the things that we do first, and then we can improve the services with the resource we have left after that. So we are making progress in terms of our approach. One final example is that now our trusts have got something called the Committee in Common, and what that means is that they can take a single decision effectively on a shared basis, so that all the trusts can effectively come to the same view about use of resources, use of their workforce, location of services. So we're starting to make some progress, and I'm really pleased about that, but there's much more to do. Yes, one of the problems is that Northern Ireland has really met some of these challenges by increasing the amount of money that we're spending on health and care, but that's at the expense of education, of skills, of transport, of leisure, and all those things that keep people well. So it would be crazy to spend more and more on health care at the expense of staying well. And we are determined that we can get better value out of the money that we've got by doing things like this reset of healthcare into community, preventing people getting ill in the first place, and looking to reduce the unwarranted variability of care that you sometimes experience across Northern Ireland.
And you've also said...
Well, I don't believe that that's the right thing to do, because, as I say, you would be robbing other government departments that are, by the way they spend their money, keeping people well. So we have got to work harder to use the money we do have in our health and care system to better effect.
We spoke